Anyway, I thought I'll talk to you about some of the work that we do in Papua New Guinea and the priorities as well as the challenges that we continue to face. And as you can see from the pictures on there, PNG is a very diverse country with about 800 different languages. And but firstly, I think I should thank you guys also for having us here, for to talk to you, and for the warm greetings that you've all shown towards us, despite the environment. But I guess that's one of the challenges that we have to face. So at the PNG, so it's Papua New Guinea Institute of Medical Research, and in short we always go PNG IMR or IMR. And a lot of the work that we do is always problem-based as opposed to curiosity-based. And a lot of these problem-based research have to have the potential for translation into implementation. We can implement them so that it saves the lives of people that are Papua New Guineans. And I guess like all research, you've got a problem, like that little child at the corner with pneumonia, and then the one with a runny nose, that's one of the risk factors for having pneumonia. And as well as the environment that we have. So the houses are part of the reason why we might have a lot more pneumonia up in the highlands of Papua New Guinea compared to the coast of Papua New Guinea. And then we look at the prevention at the bottom, where vaccines become the main preventative measure, as opposed to allowing them to go to hospital, where the most likely outcome would be that they might die. And this is a comparison of the sort of causes of deaths, and the reason why the Papua New Guinea Institute of Medical Research was established more than almost 50 years ago now, in that there was a lot of infectious disease on your left, but we are now seeing that shift from infectious disease to more non-communicable disease on the right. But we can still see that lower respiratory tract infection per se continue to be up there as the main causes of death, and that's pneumonia as well as TB. And Evelyn has already talked a little bit more about TB, and I think a lot more of you know about TB. So the Institute has these visions, missions, and guiding principles for the next, hopefully, 5 years. We haven't quite got it into a format that will be easily distributed out, but these are the basic principles, visions that we have, and it is to improve health and well-being of Papua New Guineans by providing high-quality, locally relevant research, and that this research is evidence-based, supports public health policy and practice in Papua New Guinea, as well as contribute to global health. And so there's a lot of research in Papua New Guinea that has informed global health. These are our three sort of main strategic objectives: implement and translation of research priorities, so to identify the different gaps in research and knowledges and prioritize those research, as well as human resources. So having the human resources, human beings there to be able to sustain the outcomes of research that we have, but also having the infrastructure available. And that infrastructure should also include not only the science, but also financial management. So, and I think part of the problems with capacity building is that we tend to look at the qualification of, say, somebody that wants to become obtain a PhD, but not necessarily also teach them to looking at how do you look after people. HR being one of them. How do you supervise other staff and different career of staff, and how do you make sure that the money that is coming in is being used in the correct way to make sure that it's being sustained and the research is being sustained for as long as possible. So those are probably some of the challenges that we continue to face as well. In terms of structure, we do report to the Minister of Health. We are, if you like, a defunct research body for the government of Papua New Guinea. We have a council of about, at the present time, of about 7 members. I'm currently that acting fellow up there, but I also hold the deputy directors of science, and I look after the research units that look at emerging and environmental disease, infection immunity, which is where much of my work centers around. Sexual and reproductive health is another of our major program, population health and demography, more looking at health systems, health economics, and those sides of health research. And vector-borne, of course, is a major program of ours at the PNGIMI, and both Brendan and James here, I think have done a lot of work in Papua New Guinea in vector-borne as well. And we have the supporting units that ensure that the institute runs. They've not always been successful because of various issues, but that's the way the structure is. And so under the implementation of research as part of our strategic objective, these are the different, if you like, the 5 points that we try to implement. So to investigate epidemiology, diagnosis, treatment, and interventions that can prevent, I have present there, but it should be prevent and control disease. Health issues associated with poor maternal and child health outcomes. So you know that maternal and child health are major issues in Papua New Guinea. Maternal health particularly is quite a big problem for us. Also look at evidence for workable solutions for health systems. And health systems, because of the poor health systems, poor maternal outcomes and poor child health outcomes are probably the outcome of some of the poor health systems that we have. And aside from that, we also we have to conduct research on surveillance and monitoring, and as well as inform authorities on outcomes of some of the outbreaks, emerging and re-emerging disease as well. And last but not least, we now have to shift focus from largely looking at chronic infectious disease to infectious disease to chronic disease, lifestyle disease, as well as malnutrition in both forms, where kids are either undernourished or overnourished. So these are some of the current research activities, the major ones, the ones that provide a lot of funding for us. So the one-time trial, which is looking at STI point of care, hopefully we'll start next month. We got a lot of money through Wellcome Trust and NHMRC. We've got the IBBS, which is looking at key population biobehavioral survey of health sex workers, men who have sex with men, and transgenders. That is going around 3 provinces, and we'll hopefully by next month go into Mount Hagen and end there. And what it's showing us at the present time is that despite the HIV being low in the general population in Papua New Guinea, about 0.8%, among female sex workers and men who have sex with men, it's between 8% and 14%. But that's only the preliminary data for Port Moresby. We're also part of the ICEMA, or the International Center of Excellence in Malaria Research, and we've only just got funding through NIH again to continue this program for the next 7 years. It's not as much as it used to be, but it's some money. We undertake the Global Fund malaria control program around the country. So each of the provinces are selected, and our team goes out there to see if people are sleeping under bed nets, what sort of RDTs they're using, and what sort of treatment is going on. And this program actually informs the current low levels of malaria that PNGs, or we're actively going out and saying, malaria has gone from 20% to 2%. This is the program that gathers that data to provide to Health Ministry. The Mass Drug Administration studies around lymphatic filariasis, and that has hopefully by the end of this month, the data from these studies in Bogia will help inform the WHO that the 3-drug administration for lymphatic filariasis is much better than the 2-drug administration. And I myself work on pneumonia, so part of my job, or part of the people that I help supervise job, is to, with the introduction of the pneumococcal conjugate vaccine in 2014, we're now looking at an carriage of the bacteria Streptococcus pneumoniae being an important risk factor for pneumonia. That we go around and collect nasal swabs from children and also look at their books and determine at what rate of vaccine coverage do you see a reduction in nasal carriage. And if that translates to herd immunity. And the partnership in health is a public-private partnership with ExxonMobil, who's a large gas company in Papua New Guinea. And there's a couple of models of surveillance that that studies are currently conducting in Port Moresby, in the sites where the LNG is. So it's not a countrywide surveillance, it's within the populations that the ExxonMobil is working, and they want to look at the trends where what disease do we have prior to the LNG starting, and 5 years later is there a transition from infectious disease to chronic lifestyle disease. In terms of partnership with Burnet, I think these are some of the work that we've done. I put malaria up there because I think the relationship between us and the Institute and Burnet has been strengthened through our partnership with both Brendan and James. And so we continue to have a lot of collaborations in the malaria sphere. In the sexually transmitted infections, we've got the one-time trial, the point-of-care studies on HPV, AMI, which Stanley Luchas heads, and which we are also conducting through the Institute, and the Healthy Mothers, Healthy Babies, which is, I see Chris here, but other investigators are here through COCOPO, and HIV drug resistance studies, which will begin soon with Janet Gare, who graduated through Burnet, will be leading that with CDC. And of course with TB and I guess the bottom one, health systems, health economics studies also are very important to us in determining what are the costs that people have when they go out to a health center, and is there a health system that's there for them to use. So I put Janet up there, and I put her up there because she's the first Papua New Guinean woman to get a PhD, so we are very, very proud of that, and we are very proud of you guys too at Burnet for helping us, and also Monash for training her to get there. And but I guess one of the main challenges is the continuing support and supervision, because once we go back to Papua New Guinea, you have to try and get yourself into the mix again and try to look for funding to maintain the studies that you've done, or to look for funding to go for newer studies, because the government of Papua New Guinea does not necessarily provide money that's sitting there or seed funding for research to begin. So, support, continuing supervision for postdoc would be a good way forward. Currently we have, as you can see, mostly women doing PhDs. A couple of them are here in Melbourne. So we've got Nelly Savary, who's hopefully beginning a PhD on health economics, and Pam, who's doing a PhD, currently she's in Cairns, doing writing up on HPV point of care. Maria, who's here in Melbourne, working on malaria, and malaria in pregnancy particularly, and what betel nut does to low birth weight and so on. And we've got others. There's only one guy who's doing a PhD through Michigan State University in the US. So out of the 7 or so that we've got. So we've got international reputation for publishing. Also a Center for Excellence. Brendan is the chair of the Buttressing Coalition, which, as the word says, it's a network of people that we work with to try and help us in Papua New Guinea to conduct some of the research that we do. And we have, I think, formal connections with a lot of you, or the institutions that you represent. So over the last 49 years, we are going to be 50 next year. So hopefully when I get back, I'll send an invitation to you to come to PNG next year to help celebrate. And these are some of the different work that we've done so far. Like I said, in Sydney, TB is not one of them, because TB hasn't quite been there yet, but over the last 6-7 years, we have gotten into the TB space. Right now, I think we still need a capacity, because the previous capacity has moved on to other things, and there's no local capacity to maintain the TB research side of things. I put that in red because that's sort of, yay, that's me. And that's where we work. So the big arrow is in Goroka, we're in the highlands of Papua New Guinea. where the headquarters of the PNG-IMR is, and then Medang and Maprik at the top, where all the malaria work and the lymphatic filariasis work is. Port Moresby is a sort of administrative spot, but hopefully we make it become a much bigger, better center for the Institute. The challenges of PNG, geography being a major one. Health systems is one of them. So Evelyn mentioned a little bit of this. So on your left, we still have that system where we have the national government with the National Department of Health, and as well as the provinces looking after the health centers, sub-health centers, and the aid posts. And so that has led to some of the reduction or some of the closure of aid posts and so on. Now the government is moving towards a provincial health authority, which is more what's on the right, where you have the national responsibility at the top with the national reference hospitals, and all the different hospitals come under the provincial health authority. And hopefully that will make the implementation of research outcomes much more important, because a lot of times I think the research that we do, and I've got a circle on the side there, is sort of in a parallel sphere to the implementation side of things. And when the funding of the research dies, there's no funding to continue the program in the health system, and therefore reduce deaths and chronic illnesses that we in the research community would like to see. Capacity, both Evelyn and I are mentioning a few times. For us at the Institute, it's about leadership capacity, so people at that level where they can lead different programs and have the people under them to then go up. So sufficient capacity at that level to make sure that the programs run. They can apply for grants, they can publish results, as well as do the normal supervision. Administration, little things like procurement can be a problem, especially currently where the government is informing us that we cannot, that the exchange rate is such that we cannot send more than 25,000 kina out of the country on any one day. And so if something that costs $15,000 here in Australia, we have to cut that into different chunks so that we are able to pay that one invoice before we get a product. So that's some of the sort of administrative issues that we've got to deal with. Power supply. And all of you don't have that problem here, but you can have up to 6 blackouts a day. And equipment, of course, that also influences equipment failure. And one of the other things that we face is the warranties. So we might buy something here in Australia, and there's a 3-year warranty on it, but that does not extend beyond Saibai Island. So outside of Australia, that 3-year warranty no longer counts. I've got clearinghouse at the bottom because I think having scientific papers is a good thing for our careers, but also informing politicians in a 1-page or half-a-page statement of what that research outcome is and what it means for policy is also just as important. So I think that's why I've got it there. Those are some of the challenges that we have. That's Livingstone, one of our lymphatic filariasis guy, tried to follow up patients, and of course he got stuck in the mud. I think between our research collaboration with you, the trilateral malaria program with Leanne living IMI and now based here at the Burnet, that will continue. The TB studies, I'm sure we'll continue to collaborate and build that collaboration as well. And the maternal child health studies that are currently ongoing in Kokopo. These are areas that we currently don't do very much work on, non-communicable disease. And I don't think, in conducting research on non-communicable disease, it's good that we know how much there is, but what do we do about it? Because we will not have the hospital for these patients to go and get their diabetes drugs or get blood transfusion. So I think the main preventive measure that as Papua New Guineans we can start on is to look at education as the intervention for people to start living wisely as opposed to binge eating or binge drinking. Cancers, we've done a bit of work on cancers, but there's still a lot of that. Drug abuse, not what you have, methamphetamines and those, but we do have a lot of people grow marijuana, so we've got a lot of that. We've got a lot of alcohol abuse as well. Gender-based violence, we haven't quite looked into that area yet. And of course, we talk about maternal child health, and we forget the men. Men are involved in maternal child health, but we also need to look at men's health, because a lot of the men, they think they're strong, but underneath it all is men have their own problems as well. So those are areas that potentially we could link with Burnet Institute or other institutions here in Australia to build capacity around and continue to conduct research on. Some of the areas that I personally think that are important, and one of those is health systems. I think without a system, like I said previously, to make sure that the results of the research that we are conducting gets to the person that matters, without that system being available, the research might be not as meaningful as it should be, because of the roads, or because of the bridge, or because of no power in the health center. So having the human resources to write, to analyze data, to be able to look after other human beings that have an attitude problem, or it might be me that has an attitude problem compared to them. Those sorts of relationships we need to probably in the workplace also foster. Funding, I know we all face funding issues. I think even our government doesn't provide any funding for us, our research, so we've got to find a way to make sure that there's funding for young researchers who are coming through to learn to conduct research. I'll just say the very last statement. I think together, you, us, Papua New Guineans, institutions in Papua New Guinea, I think together we can strengthen a lot of the sort of challenges that we continue to come and talk to you about. But I think together we can help fix a lot of these issues. So thank you very much.